You're listening to the Your Knee, Your Health podcast. I'm your host, Adam Rosen. I'm a fellowship-trained, board-certified orthopedic surgeon who specializes in knee replacement. Here I'll talk to you about common knee complaints and other orthopedic issues. We'll cover other important health-related topics, all of which are meant to helpfully answer some of your questions and help improve the quality of your life. Thanks for listening, and on with the next episode. Hello and welcome back. This is Adam Rosen, and you're listening to the Your Knee, Your Health podcast. So in today's episode, I'm going to talk to you a little bit more about food and nutrition. And again, I'm an orthopedic surgeon. I'm not a nutritionist. I don't have a degree in nutrition, but I'm interested because I like to eat. I like to eat healthy. I've always enjoyed eating healthy. But I also have a lot of patients that come in with questions. And if I don't know the answer, I let them know. I don't know, but I'm going to look into it. And it's hard too because, in med school, and I do honestly believe this is a deficit in medical school education, is there really is nothing that really teaches us about nutrition. And if you think about it, our body is this incredible machine that has to be fueled appropriately and properly. And, what has happened is that people don't know what to eat and they make poor choices. And this leads to disease. There's a lot of diseases that are related to how and what we eat. You look at the obesity epidemic, you look at heart disease, you look at cholesterol, you look at liver disease. You look at all of these different problems. And, not all of them. Some are genetic and some are hormonal and related to other disease processes. But there are a number of diseases that are related to what and how we eat. And if the patients don't know what to do, and the doctor doesn't know what to do, well, how is anybody supposed to get better? So I think it's really important that for patients to be your own advocate and to try to learn, more about what you're eating and how to eat. But understand that's difficult because the internet is out there with lots of information, and sometimes it's hard to decipher what's real or truthful or science-based and what's not. But I think doctors also owe it to themselves and to their patients to learn a lot more about nutrition. So, I've constantly tried to learn a lot and as much as I can about nutrition, but it's an evolving science. And, what's interesting is because I get the common question, well, doc, what can I eat? I want to eat an anti-inflammatory diet so I don't have arthritis. And it's not that simple. Because we have food allergies and we have food sensitivities. So what may be good for one person is not going to respond well in the other person. And we also have this thing called the gut biome. It's this incredible kind of collection of different types of bacteria that live in our gut. And a lot of what we feel and a lot of our body's functions we're starting to learn are related to this delicate balance of bacteria that lives in our gut. And if you ever notice, if you go on vacation, you eat different foods, you drink different water. This is the extreme version would be, the old thing of don't go to Mexico and drink the water and, you get horrible diarrhea. But, even somewhere where you don't get diarrhea, you may notice that, your bloating gets better or worse, or your stool changes color or, smell. And all of those things are related to the variation in our gut flora. And there is a lot of important science coming out that shows that the diversity of food is really important to keep a healthy microflora of all this bacteria. And when you look at inflammation, there's different authors and doctors out there that will talk about different foods that they too believe are more likely to cause these inflammation problems. And the extreme version for some patients is they need to cut all the way back and do an elimination diet, and then figure out which foods work well for them, and then slowly introduce foods to figure out what their trigger is. You have the nightshade family, and there's one particular author that talks about trying to avoid all of the nightshades. You have people that can have small intestinal bacterial overgrowth called SIBO, and they talk about having a FODMAP diet, which decreases the types of potential sugars and how your body converts it, and the bacteria convert that, which can cause symptoms. The extreme is gluten, and, specifically for people that have celiac disease, that can cause this reaction in their body that, a lot of times is described as an allergy. It's not a true allergy like somebody would get from a peanut allergy, but an autoimmune process where their body will start to attack the intestinal lining because of this protein in gluten. But then it gets back into the whole idea of the food chain and genetically modified food. So again, super, super long, detailed discussion that I'm just going to touch upon in different episodes. But, some of the more common questions that I get asked about when it comes to things which are food related, which may be anti-inflammatory, and patients ask about most commonly is turmeric, and the compound is the curcumin. So this has been shown to have these anti-inflammatory and antioxidant properties. So there is some scientific data out there that shows that actually this can be helpful. Now, when you eat regular turmeric, if you haven't used it, it's actually a really, really interesting thing to cook with. It's a root. It looks sort of like ginger, and you can peel it with a vegetable peeler. Sometimes if it's a big enough, you can use a knife just to cut the edges off, or actually a spoon works well. You can just kind of peel off the outer bark essentially with the spoon, and you get this bright, vibrant orange root, and you can chop it up. You can mince it. You can use a ginger grater or a fine cheese grater to kind of grate it down. And it's nice because you can add it to rice dishes. You can add it to soups, and I've used it in salad dressings. And, you can use all sorts of different recipes that will use that. And you get this nice, vibrant orange color and this flavor. But the actual curcumin is a very small amount. So, in certain cultures where turmeric is used in super, super high amounts and high volumes on a regular basis, they may be getting some of these long-term benefits from prolonged ingestion of these amounts of turmeric over time. But a lot of times the turmeric supplements have such a higher amount of curcumin that if the anti-inflammatory properties are what you're looking for, you may get more of that out of that supplement. Now, what's interesting is that the addition of black pepper has been shown to increase the absorption when you're using actual whole turmeric in foods and things like that by up to 2,000%. I mean, this is pretty amazing that there's some reaction there or some sort of cross-reactivity. I don't really understand. I haven't delved that much into it as to the actual scientific pathophysiologic process. But if you have ever done like one of these immunity shots or these shots that have the turmeric and ginger, they always have black pepper in there. And the reason is that this black pepper, when you're using whole, food type turmeric, not the actual pill, it will increase the absorption of that turmeric by up to 2,000%. So, is it helpful? Well, some studies have shown that it can reduce the risk of heart disease. It can also decrease the chance of other chronic diseases, and it can reduce inflammation. So it is one of those things, and you may hear me talk about it over and over again, that when it comes to supplements and things like that, things that you're interested in trying, I always say if you're going to make the effort to try it, don't take it here or there. This isn't the, I take a, turmeric pill or an immunity shot with turmeric, once every 6 months. That's fine. You can do it. But if you're looking for it to see if it makes a difference in your general overall symptoms of inflammation, what you should do is, find a reputable product. You need to look into, how it's made, how it's manufactured, how it's tested, make sure that you're truly getting what you're buying, and then make a conscious effort of adding that one thing for a period of time and really assess your symptoms, stop it, see do the symptoms change, get worse. So if there is a true benefit for you, then it's something that, may be helpful. Now, the next thing, just to briefly talk about, along with that, I'm not going to go into as much detail, but the idea of ginger, simply because a lot of recipes, we do a lot of cooking in my house, and a lot of recipes call for the combination of ginger and turmeric, that ginger is another root, which is an excellent thing to add to flavor foods, soups. It's definitely used in a lot of Asian-inspired dishes, but it's great actually for nausea. It's really nice, a little hot water and, a slice of ginger, put it in there. It's great for nausea, which is something that may be useful if you suffer from nausea or after surgery. If you're having issues with nausea, it's something that you can use. And there have been some studies that have shown that it actually may be helpful for inflammation as well. And there's actually a really interesting, you've probably seen or heard about the idea of this golden milk. It's a great little kind of soothing drink that you can make. It's, typically made with coconut milk, but you can use it with any of the nut type milk products. We've made it with macadamia nut and almond milk. But you add in typically fresh turmeric and fresh ginger. I guess in a pinch you could use the powdered forms if that was all you had in your kitchen. Adding in some black pepper, and you'll notice the concentrations. You can find them, online on a lot of different websites. And if you simmer it for a while, it produces this vibrant sort of golden orange drink, and it's reported to be soothing and anti-inflammatory and can be really helpful for lots of things. So it's something that we make on occasion, but I do have some patients that really enjoy this combination of the ginger with the turmeric with coconut milk or something like that, and make this golden milk. So it's something that you can look into trying. Now the other thing which is really interesting that I've delved into, and every day I seem to learn a little bit more about, is the idea of green tea. So green tea is this other interesting food product, essentially, that is antioxidant and can be extremely helpful. And one of the best ways that you can potentially get this is the idea of matcha. So green tea, the green tea leaf, and as I looked into matcha, it's really interesting because it's the way that the product is produced. So with matcha, they actually use the whole leaf, and there's a whole process of when they cover it and when they pick it and all the different processes. But once they get the leaf, then they grind it into a powder. So it's this one tea where, typically with teas, you're used to the leaves that either come in a bag or a satchel, or you have your own, container of fresh tea that you'll put into some type of tea strainer and produce your own tea. But with the matcha, you can actually consume the entire, powder. And it's, these tea ceremonies, it's a whole process. But, when you make your green tea at home, you make your matcha, you can get the powder. And there's a process of, heating up the cup and, then, heating up your bamboo whisk, if that's what you use. I find actually that does work the best. Otherwise, you get clumps. And then dumping out the water. And then I've been told and taught that the best way to keep the matcha powder fresh is keeping it in the freezer. You add your fresh matcha and you stir it and mix it and get this nice kind of frothy. And it's a great, delicious drink that has a lot of these great properties. So it's this chemical in it called EGCG, this catechin and it's I may mess up the pronunciation, but it's epigallocatechin gallate. And the highest concentration of this chemical is found in nature in matcha. And it has some effects on the cardiovascular system, and it has this metabolic effect, and it can help with weight loss and decrease cholesterol, and it may even potentially have anti-cancer effects. So here's this great, drink that you can use, and it has all of these additional properties that may be helpful. Now, people worry about, well, am I getting too much caffeine? Well, it's a really small amount. About a half a teaspoon of matcha only has 35 grams of caffeine. And the daily max of caffeine recommended is around 400 milligrams. So it's a very small amount of caffeine that you'd be getting, but it does, give you a little stimulant. But here's this excellent thing that you can use, which is tasty and delicious and warming, but it has all these excellent properties that may be beneficial for your health. And the third or the last thing, I guess typically the fourth, but we just talked about ginger briefly. But the other thing that I want to talk about lastly today, though, which I get asked about a lot, is the idea of, well, wine. I heard wine was really good for you. Should I drink wine? I'll drink more wine. And, a lot of this came out from the French paradox study that really found that when they looked at the French and they attributed the wine to the positive health benefits that they saw in the French as far as cardiovascular disease and things like cholesterol. So what's interesting is in the wine, you get these things called polyphenols. And, polyphenols are typically coming from the skin and the seed. So when you drink white wine, there's a very small amount of polyphenols. It's only about 0.2 grams per liter, where with red wine, you get 1.8 grams per liter of these polyphenols. So when someone says, yeah, I heard that wine's really good for you, drinking a lot of white wine, you're not going to get the positive health benefits of the polyphenols. You're going to get that from red wine. And, I've been told, and I've read a few things. I got to look if it's 100% correct, but also sometimes just red grape juice. Even if you don't drink wine or you don't consume alcohol, you may get a lot of these same polyphenols from just red grape juice. But there are a lot of benefits. It may decrease platelet aggregation, and platelet aggregation, if those platelets clump, are the things that can cause heart attacks and strokes. It can increase your HDLs. So your HDLs are the cholesterol. If you get your cholesterol panel and you look at the HDLs, are the things that you want to have a lot of. They're good for you. And it may also increase what's called nitric oxide, which can help cause a little what we call vasodilation, or dilation of the blood vessels, which also can help with blood flow, especially, to the heart muscle. But the effect is dependent on the dose. So like anything in life, too much of anything is not a good thing. So if you're a female, typically it's recommended to have a glass of wine per day. And if you're a male, it's recommended to have up to 2 glasses of wine a day. And with that recommended dosing, those are the people that may see these health benefits of these polyphenols that come from the grape. Where if you start to drink more than that, you're drinking 3 or 4 glasses of wine, you fall off a cliff. And now those health benefits go away, and you actually are causing detrimental problems to your health, and it can cause a lot more issues. So you really want to watch, if you're going to drink wine for the reported health benefits, you need to be cautious of how much wine you drink. So all of that together is, information. So things that you may want to think about: looking into turmeric and the curcumin, try cooking with it. For the health benefits, you're going to get higher concentration in the supplemental forms. You may add ginger, the idea of turmeric and ginger for the that golden milk. The idea of the EGCG that you can get from green tea, and more specifically from matcha, and the idea of these polyphenols that you can get from red grape juice or red wine in moderation. And all of these are just things to kind of think about as you start looking into what you eat, and how you eat, and how what you put into your body can affect your health. All really, really important things. But like I've always said, though, too, depending on whether or not you have underlying health conditions or take other medications, if you start to add things and you're using things like supplements on a regular basis, or even food products that are different on a regular basis, let your doctor know, because occasionally these supplements can interact with other diseases or other medications that you're taking. So I hope that you've found the information helpful. We'll be talking a lot more in future episodes, just more and more about food and nutrition. You've been listening to the Your Knee, Your Health podcast. I'm Adam Rosen. Thanks for listening to the Your Knee, Your Health podcast. If you've not already done so, please subscribe so you'll be notified of future episodes. And if you enjoy what you're hearing, please take the time to leave a review. It helps other people like you find the show. I'm your host, Adam Rosen, and until next time, stay safe.